Drug mechanisms and effects. Sarms stands for Selective Androgen Receptor Modulators. This means it's the tissue-selective modulators that activate their cognate receptors in a tissue-selective manner that provides an opportunity to promote the beneficial effects of androgens and other hormones in target tissues with greatly reduced unwanted side effects. They target specific tissues, like muscles and bones, rather than affecting the whole body. By activating these receptors in muscle tissue, Sarms stimulate muscle growth and strength, without causing as many side effects in other organs, such as the liver or prostate. They work by increasing protein synthesis in muscle cells, helping the body build more lean tissue. However, while they're marketed as safer alternatives to steroids, Sarms can still disrupt natural hormone levels, and their long-term safety is not fully understood. Legality and regulatory risks. According to an article from Food Additives and Contaminants, no SARM has received clinical approval to date, nor have any been launched as pharmaceutical product. Moreover, SARMs have been prohibited from sports since January 2008 by the World Anti-Doping Agency. It is often marketed in the gray market. The products may be mislabeled or contaminated. The consequences for athletes are that positive tests can lead to suspension, fines, or lifetime bans. It is unregulated quality, so there are no standards that exist for purity, dosage, or labeling, increasing legal liability. There can be import and export issues. Shipping or purchasing SARMs across borders can violate national laws. There are advertising restrictions. Companies marketing SARMs as supplements risk legal action from regulatory agencies. While there is still not extensive research about SARMs, there are already known health risks, such as hormonal disruption. SARM suppresses natural testosterone production, leading to hormonal imbalance, infertility, and testicular shrinkage. Liver toxicity. Use has been linked to liver damage and elevated liver enzymes. Cardiovascular risks. They can lower HDL, good cholesterol, and raise LDL, bad cholesterol, increasing the risk of heart attack or stroke. Unknown long-term effects. Because SARMs are not FDA approved, their long-term safety is still unclear. Contamination and mislabeling. Many products sold as SARMs are unregulated and may contain harmful or undisclosed substances. Lack of medical supervision. Most users take SARMs without professional guidance, increasing the chance of misuse and complications. The use of SARMs raises several ethical concerns, especially in sports and fitness. Because they can enhance muscle growth and performance, they create an uneven playing field, violating the principles of fairness and integrity in competition. Their unregulated sale also poses a public health dilemma. Companies often market them as safe supplements despite known risks and lack of FDA approval. Ethically, users face the question of personal responsibility, whether the pursuit of performance or appearance justifies risking their health. Finally, the lack of informed consent is significant. Many people use SARMs without fully understanding their dangers, raising questions about how society should regulate and educate around these substances. Although I believe at the end of the day, it's the consumer's responsibility to do the research in the best interest for their own health.